Histoplasma by Camille Flakus
and Olivia Pluta.
The three domains of life are eukaryotes, archaean, and bacteria. But what is histoplasma? Histoplasma is the fungi, which is known as a eukaryote. A typical cell-level organism has a narrow blunt neck measuring a 2 to 4 UM in diameter. It has a grainy white appearance which slowly turns yellow/orange over time. Histoplasma is multicellular and it reproduces sexually.
Histoplasma will most likely be found in damp soil, which is associated with bird or bat droppings. It is mainly found in eastern states in the U.S., which includes Ohio and the Mississippi River Valley. It also thrives in parts of Central and South America, Asia, Africa, and Australia.
Epidemiology, the branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health.
An estimated 250,000 people a year are infected. The rate of infection is 3.4 cases per 100,000 people. This picture is a picture of the Mississippi River Valley.
The rate of mortality for histoplasmosis is 5% for children and 8% for adults. This depends on how strong your immune system is. Like if you're a kid, elder, or suffer from HIV or AIDS, there is a higher death rate. The case of morbidity is 60 to 90%, depending on where you live and what your surroundings are.
Pathology, the causes and effects of a disease. Histoplasmosis can affect any part of your body from your lungs, skin, mouth, and central nervous system. Without treatment, histoplasma can cause damage and diseases such as acute respiratory distress syndrome, which is when fluid leaks into the lungs, making it difficult to breathe, heart problems, adrenal insufficiency, which is when adrenal glands don't make enough certain hormones, and meningitis, which is inflammation of protective membranes covering the brain. The damage it produces is normally when you don't get it treated. It gives lung and breathing problems, and also heart problems.
Symptoms of histoplasma include fever, chills, headaches, blood pressure dropping, coughing, chest pain, bleeding in the stomach or intestines, and lastly, enlarged spleen and liver.
The disease progresses through the bloodstream outside the lungs and slowly takes over your body, that which can lead to death.
The main medical treatments that exist is called itraconazole, as well as the antifungal medications that exist. More medical treatments that exist are fluconazole and amphotericin B. These treatments affect the progression of the disease because antifungal medicines work by killing the fungal cells.
To prevent getting histoplasmosis, you should avoid projects and activities that can expose you to the fungus, like going near bat or bird droppings, cleaning chicken coops, exploring caves, and cleaning or remodeling old buildings. If you are to do some of these things, then you should spray the contaminated surfaces, and you can use an effective face mask to not inhale the spores. The public health authorities are reporting the cases, they are trying to develop new diagnoses, and in Latin America, they are creating new laboratories.
Histoplasma was originally discovered in 1905 by Samuel T. Darling, but was discovered to be a common infection in 1930. In Panama, 1905, Darling discovered an unusual autopsy in a 27-year-old carpenter from the Caribbean island of Martinique who worked on a canal at this time. His lungs were filled with granulomas, which is a collection of immune cells. It is usually formed from inflammation from a disease. Then he did 2 more autopsies on people that worked near the canal, and they looked similar. These patients had different symptoms, the symptoms of malaria and yellow fever. He performed more autopsies with people who died from these diseases and noticed a lot of differences. So he discovered it was a different disease and called it Histoplasma capsulotum.
Hello, thank you for joining me here today, November 23rd, 2017 in Arizona, where a 7-year-old patient that had been suffering with cancer-like symptoms for 30 years ended up having histoplasmosis. Histoplasma is not very common amongst us people in Arizona, so this is a call sign to beware of this pathogen. A CT scan followed by an MRI showed a lesion on his brain, and his doctors feared the worst: cancer. But more MRI scans noticed that there were masses in both his adrenal glands, and then saw that it was histoplasmosis. Thank you for joining me here today. Have a good night.
Thank you for watching and listening to our presentation, Histoplasma.